Hi, my name is Dr. Niraj Joshi. I am a senior consultant for ENT head and neck surgery. Today I have been asked to speak about headaches. It's a very common thing that almost everybody experiences once in a lifetime. There is not a single person who will not say he has not had headache. Very rarely will see such people. But yes, headaches are very common and they are increasing day by day. Now, why have headache become more frequent? Why do you have headaches? From small children to middle age group to senior citizens, everybody gets headache then and there. So let us come about to talk headache from pediatric group, small children. Headache for small children group. The most common thing for people who are below puberty or school students, okay, till say 15-17 years of age. The most common cause is having an eye problem, vision. They will complain, morning I get up, I am fine. As I go to school, evening times, I start having headaches. And they'll come back to home, throwing their bag and sleeping on the pillow, saying I'm having severe headache. Sometimes parents may think they are just lying, they don't want to study, other things. But yes, they may be having headaches. For that, please get an eye checkup done. That's the most common cause. Second common thing for school children having headaches is sinus problems as well as adenoids and tonsils. People who have recurrent cough and cold, they may have such sort of headache, but they will tell, I get up in the morning with headaches, I sleep with headaches, heaviness. Okay, so that may be the second cause for pediatric children. Third cause, most commonly, is having diet, food habits. Okay, they may not eat their lunch or breakfast or evening tiffin on time. That will lead to low sugar levels and they may have headaches. Other than this, there are more causes, lot of causes for having headache, but let us keep very simple this topic discussion. So there are most common three things I have discussed for pediatric age group. Coming to middle age group. Nowadays we see many people doing this computer IT jobs, okay, and even they say same thing that they are having a lot of headaches. And for them they even say headache I got, then I am having some dizziness also. Okay, I got headache, then had some vomiting also. Okay, they'll say I have got some blurred vision also. So this youngster people like who are middle age, say from after the college when they start working, before marriage, that group say from 20 to 30 years, they also have headaches. And the causes for those group for headaches, the most common things what we see is, as I told you before also, eye problem. It should be checked. Yes, any headache, eye should be ruled out first. Second thing is that sitting and working module. They may have something called spinal headache. They'll tell I'm working on the computer, I am fine. Suddenly I start having some pain and then the headache starts from here till in the front. Sometimes it's one-sided, sometimes it's both-sided. But then if the headache is so heavy that I have to go and lie down, or I may get some dizziness also. This is because of not sitting properly on the chair to work. They may have the headaches. Or looking too much screen time will also cause them the headaches. And this age group, they are also very irregularly on diet habits. But this age group will not have more of a hypoglycemic than actually their sitting posture headaches. This is just I am talking about our lifestyle. Okay. Yes, we have other causes, medical causes for headache like sinus issues, some brain issues, or some sort of nerve-induced headaches. Okay, but this 80% of times will be more of your day-to-day activities and schedule. People who are like females, married with one children, or married and they're having two children, they're also working women, as or some people may be homemakers. These females, this ladies group who are having headaches, it is mostly due to their psychological condition. They may be very emotional. They will just have emotional outbursts. Okay, they'll cry sometimes. They'll have sleepless nights. Okay, and they'll be also sometime having incidences where they'll be like very rude towards others. It's more of an emotional. Okay, we see many patients nowadays who come with these big files. They come and keep on the table, tell I'm having headache, I've got all the tests investigated, nothing is working out. It's just like the clinical history what helps us to tell you how to take on with the headache. Yeah. If patient says they have cough and cold and due to cold they have having headaches, it should be investigated by an ENT. If people says they are having headache due to some sort of food diet, they'll tell if I go out in the sun, I get headache. If I don't eat for too long, I'm empty stomach, I get headache. Example, I don't have proper sleep, I'll get a headache. If I'm sitting in the bus or car and doing long traveling, I may get a headache. If I eat something, I eat Chinese food, say noodles something, I get a headache. I eat too much spicy food, I get a headache. If I eat chocolates, I get a headache. Now these headaches are into migraine pattern. They'll have mostly one-sided headache. They'll say only one side headache and blurry vision, eyes are very heavy, and this will start from your front, go till the back of the neck, the ear, neck, spine, everything is like very heavy. These headaches are basically triggered due to some mechanism. If you are able to identify who's triggering the mechanism of headache, it will be easy to treat you. Sometimes these migraines can be completely treated provided the irritant is not there. We do have medical managements, we do have other sorts of management for all these things, but what a patient can do is identify the trigger himself and prevent that for long time. That will definitely give a very good relief to them. We have migraine trigger pads. We have a big small sheet of pads where they can, whenever they have headache, they just have to think 1 hour or 2 hours before what I ate, where I was, what I did. If you make a note of this, say for example 3 times, 4 times, 5 times when you have headaches, you can easily link one common factor in all the pattern. Then you can tell, yes, this is one common pattern mostly I am seeing in every paper of mine, and you can try with that pattern and you can stop eating, that headache will go off. Migraine headache, yes. And it's troublesome actually. It will give nausea, vomiting, it will be like hell. It will take, some people take 12 hours, 24 hours, 48 hours for the pain to go off. Some people keep on popping a pill without knowing the reason. Please don't pop a pill. Going across the pharmacy, taking a tablet for headache and telling that headache should go off as if now. Try to identify the cause for everything. Headache is not a disease. It is a symptom, somewhere something going wrong. If you find who is causing that wrong and prevent that, headache goes off. For example, if somebody has fever, fever is not a disease. There is something giving him fever like dengue, malaria, virus, COVID. You treat that cause, the fever goes away. Same way, headache is not a disease. People say, I live with headache. Sorry boss, that is wrong. Headache, that means the body is telling you somewhere something wrong. Please identify and treat me. You should be smart enough to find out the reason, or meet a colleague or meet a doctor, find out the reason for headache. Don't just keep popping a pill. Once you find the cause, treat the cause, no headache. It becomes simple. Coming to senior citizen group, people who are quite senior, they also come nowadays with headache. Okay. This senior citizen group headaches needs to be investigated. That age group, we cannot tell that this is the reason, that is the reason. The most common thing, if you want me to tell you, is hypertension, blood pressure. The more higher the BP, the headaches will come. So definitely senior citizen group needs to be investigated for mostly medical causes of headache. If there is no medical cause, then other things. But yes, 80 to 90% of time, senior citizens will have a medical cause that needs to be investigated. Don't be afraid of headaches. It is easy to treat, okay? But yes, it's not good to have a headache. Sometimes people think, oh, 1 week I had no headache, suddenly next day they'll have a headache. Don't think about it, okay?
Hi, doctor.
Hi.
What's the difference between normal headaches and migraines?
Okay, thank you. Normal headaches, there is nothing called normal headache, okay? First of all, headaches are all abnormal, okay? How to differentiate between migraine and other types of headaches, right? Migraine headaches will be mostly one side of the head, right or left. As I told you, migraine headaches will stay for more longer than even you can think, okay? Migraine headaches can give people nausea, it can give vomiting, it can give like dehydration. Migraine headache people will tell, I don't want, once they have headache, switch off the lights, I want a dark room, any noise, I don't want to listen to any noise, I want peace, just put some pressure on the head or with the hand or pillow and just go to sleep. That will give them very good comfort. They don't want to see any brightness or hear loud noise, will trigger more. Other types of headache, they may have a complete head, not one-sided. It may start from your eyebrows, from both the sides. They may have a facial pain. It may start with the entire head from front to back getting like one big stone has been kept on the head. Okay. There are other reasons for every headache. We ask every patient, can you point with your finger, where do you have the headache? How does it start? How do you get relieved of it? Okay. All those things help us to treat them out. Everything can be treated, even a headache or a migraine headache, anything.
Doctor, I spend a lot of time on my phone. Will that give me headaches?
Yes, we have something called a screen time. It will give headaches. Okay, I'll tell you why. One is the neck posture. Okay, people sit on the phone like this. The weight of our entire head is on the spine. The moment you leverage it bend, it becomes 2 times, 4 times, 10 times double for the neck to lift the weight. Okay, the whole thing will start straining from here. One. Eyes, they are at one position looking at one screen without movement and the light is getting reflected continuously. Okay, that will cause you neurological headache from the eye point of view. Okay, anybody who spends too much of screen time will definitely experience heaviness, headache in and around their neck, front and back, everywhere.
Doctor, I work in a loud environment. What should I do to prevent headaches?
Yes, acoustic headache is something like due to loud noises. People who work in music industries or some people who like one guy came, I went to marriage yesterday, I was standing near the speaker and then I got a very big headache. Yes, noise induced headache, noise induced giddiness and vomiting, all are becoming common. If you are known to have headaches or symptoms due to the heavy noise, you are supposed to completely possible avoid it. If unavoidable, you got to use something called earplugs to plug in the ear. We have headphones, like people who work in with heavy machineries and with drilling noise machines, they always use the headphones for the noise not to go in the ear transmission. People sometimes they like people who are flying in flights or jet engines, even they have headache when they sit near the wings. Okay, preferably keep something over the head. That will really help you. We have ear plugs, cotton plugs, whatever can help you to prevent the noise reduction in the ears. Yes.
Doctor, should we self-treat headaches?
If you know the headache is not serious and you have been getting this very often, if you know the cause for headache, you can treat. Headaches sometimes can be due to multiple reasons. there is something called as a fear which is going on around everywhere. If somebody has headache, they go on the net and read the causes for headache, and they'll see 10 things, all negative points goes into the brain, and they go to the center and tell that he has a headache, he wants a scan done. He will do the scan report will be normal. He will not believe that. He will believe what he read somewhere. Go to another scan center, do one more scan. They come with so much of scans saying that he has headache, he has some problem, but the scan is not showing it. It sits over here. Those kind of patients should never ever try to do self-treatment. They should never ever try to do even self-education about medical things. That's really bad. Home remedies for headache. What you can do self-treatment if you know that the reason for the headache. If there is no possible accessibility of any medical management or store nearby you, take a paracetamol. Simple. Okay. You can sip some warm water. Do some hot fermentation on the neck. Okay. You can, yes, if you have some medical accessibility next by your home, please get it done. Getting headaches too often is not common. Okay. Please try to find the cause for the headache. Don't leave it like that.
Sir, when should we decide when to visit a doctor?
For headaches. Like for example, as I told you before, headaches are very common. And if I know that I ate Chinese and this will give me headache, then it's okay. I got to avoid Chinese, not visit a doctor. If I know I'm going to go on long travel in train or in bus, I'm going to have a headache. Okay, it's okay. You don't need to visit a doctor. You know this is the reason. In case you find different types of headaches, okay, like you're already having headaches on and off due to other reasons that you know, and you're getting different pattern of headache, then you need to visit a doctor. If you don't know the cause for headache, please visit a doctor. Don't try to do self-study. Don't try to go on the search engines to find something. Nowadays, we are so much into negative world, we read only negative points in the 10 positive points. And we try to just say, okay, keep all these things in the mind and keep on rolling. You need to visit a doctor in case you don't know the cause for headache. There is a cause behind everything. Our body is so smart, so intelligent. Our body knows when to give symptoms, when not to give symptoms. If I am doing something wrong, my body will give me a symptom. Okay? The specialist will know why. Sometimes your doctor may ask you to visit few other specialties also to find out the cause. Please do it. It's for your own good sake. Nothing wrong in that. Okay?
Doctor, does drinking alcohol cause headaches?
Wow. So you want to drink alcohol? Good. Yes. If you drink alcohol, it will cause headache. Okay? It is because of that. One is the pressure. Hypertension one will increase the blood pressure, it will cause headache. Alcohol will have water retention. The water will be like, if people drink alcohol, then there will be no water retention and it will take off all the glucose from the blood. Okay, that all will cause headache. They'll had alcohol in the night, morning you get up, oh my god, I got hangover. Boss, this is not hangover. This is because of the alcohol what you have taken, the side effect of the alcohol. Okay, that may stay for a few hours. You got to hydrate. In case you are having alcohol, then got to hydrate yourself very nicely. Eat very nicely. Keep the glucose levels balanced. Keep your water intake level balanced so that you don't experience the hangovers or early morning headaches after alcohol intake.
Doctor, because of my work schedule, I can't get enough sleep. How do I avoid headaches?
You got to avoid work, baby. Because of work schedules, sometimes nowadays we see so many people in the IT field, other fields, they overwork. From morning they'll start say 9 or 8 till night 10, 11, 12 they'll be working. Okay, that is not right. That's not right. If you're driving a car, you drive too long without giving it a rest, engine becomes very heat. Okay, the car seizes the engines. So don't push yourself too much that your body starts resisting and giving symptoms and then you start finding out the reason for the headache, then you stop going to work. Limit your job. You should know your body very well to know that I can work 8 hours a day, I can work 10 hours a day. Don't push it beyond that. Okay, the moment you push it beyond that, body will give you headaches. It not only headaches, it will give you other multiple symptoms also. Okay, know your body. You will be knowing it much better than anybody else. That if I do this, I'll get headache. Don't do that.
Doctor, is there a relationship between tension and headaches?
Yes, nowadays we see a lot of people with tension headaches. They will come to us with something like headaches. They'll say it's like a band. Okay, like the tennis players or cricket players, they wear a band like this. It will be like a band. It's a band type headache. And they will tell they have headaches, it's chronic, I take paracetamol, I take some medicine, it's okay for 2-3 hours, again it comes back. Okay, those headaches don't go very easily. They are because of stress, tension, too much of overthinking, sleeplessness, fear among them in the mind. They'll give you tension headaches. Or pressure, like people nowadays have got some deadlines, you got to cross this deadline, and that fear in the mind will give them this sort of headaches. That's not good. Tension headaches can be treated. You just need to come to ENT doctor or anyone nearby your house. Just go tell them the symptoms. History taking is very important. Not just do this and come back. You got to spend some time with the doctor. Go tell him what symptoms you are having, what pattern of headache you are having. Every headache you point will have a reason. Headache here, I got headache here, I got headache here, I got headache like this, I have vomiting, I have this. Everything will lead us to small solutions to help you that okay, this is the reason, you do this, you will be fine. Yes, stress headache is becoming too common nowadays. Okay, and this needs to be answered.
Doctor, at what point does headaches be classified as long-term headaches?
Okay, when people know that I am having headache for more than 6 weeks or 4 weeks and it is intermittent and coming regularly and troubling me, that needs to be definitely assessed. Headache once a week, headache once a month, okay, they are like not very important, but yes, there should be a reason, you can find out yourself. Daily basis headache, getting up with headache, sleeping with headaches, and you take some medicine, you are fine, but it is there for more than 7 days, 2 weeks, 4 weeks, maximum limit, please go meet a doctor. Multiple reasons, starting from the brain, neurological issue, to hormonal issue, to sinuses, to vision, to neck, to vitamin deficiency, everything may be the reason for headache. Okay, so don't think it's just a simple headache. Headache may be sometimes just nothing, sometimes may be atom bomb. So you need to find out the reason from your doctor and get it treated. Every headache can be treated. We just got to find the reason and the treatment becomes very simple.
Okay, thank you, doctor, for this Q&A section.
Thank you very much. I want to remind all of you, no headache is untreatable. Everything is treatable provided you know the cause. Okay. Headaches have become very common nowadays is because of our self under realization. If you realize your body, how good it is tuned, how fast I can walk, how fast I can like sleep, and from drinking habits to working habits to your sports to physical activities, your day-to-day schedule, everything matters for the headache. If you are getting headache, please identify the cause, treat the cause. Your body is giving you symptom, boss, somewhere something wrong. Okay, find out who's causing wrong, it will be fine. You don't give it importance that somewhere something will become a big something wrong, then that becomes a problem. Okay, the earlier you come, the more simpler to treat. Thank you, take care.